Hello, I'm Dr. Terry Portis, and before we get started in our study of abnormal psychology, I thought it would be good to take a few minutes to determine what is abnormal. So when we talk about abnormal psychology, what do we mean, and how do we determine whether something is abnormal or not? First of all, I think it's important to say that it can be very difficult to determine what behavior, emotions, or thinking processes should be considered abnormal, which is a word we've already used. A word that we also sometimes hear is the word psychopathological, and we also may use the term psychological disorder. So as we look at all three of these, it can be difficult to determine what is a psychological disorder, what is psychopathological, what is abnormal. Well, there are 5 keys that we look at, 5 key principles, 5 key ideas that help us determine what is abnormal or psychopathological. The first term that we may use, or the first principle that we would consider, would be feelings of discomfort or unhappiness or emotional distress, and those fall under the term subjective discomfort. After subjective discomfort, we might also look at statistical abnormality. This is having extreme scores on some dimension, such as intelligence, anxiety, or depression. We might also thirdly look at social deviance. Social deviance is disobeying society's standards for what is considered normal conduct. This usually leads to destructive or even self-destructive behavior. We would also look at situational context, the social situation or the behavioral setting or the general circumstances in which an action takes place. For example, we might use the occasion or ask the question, is it normal to walk around strangers naked? Well, most situations that you're in day to day, most settings that you're in, that would be considered highly abnormal and may result in a call to the local authorities to have this person taken away. However, if you're after class or after work and you're in the gym and you are changing clothes to get ready to work out, it may not be unusual at all to have people walking around in various stages of undress and no one thinking anything about it at all. Certainly a lot of folks are uncomfortable in that setting, but nothing that we would consider necessarily abnormal or psychopathological. We would then look at the idea or the principle of cultural relativity. That is, that judgments on what is abnormal or psychopathological are made relative to the values of one's culture. So, for example, in our American culture, if I were to kill a goat and take its blood and smear it on the side of my neighbor's house and around their doorway, that would again be a setting or a behavior that would bring a quick call to the police or other authorities, and I may be carried away and institutionalized for a while. However, there may be other cultures in the world where this type of behavior would be considered a type of blessing, asking fate or some gods to bless them. Well, then if I'm doing that, the neighbor would probably thank me for doing it and invite me in and tell me more about what's going on in their life. They wouldn't think it was psychopathological or abnormal, certainly at all. So then this brings us to consider, as we put together all of these puzzle pieces to try to determine whether something's abnormal or psychopathological or even a psychological disorder, each of these keys that we've just mentioned, there's actually a problem with every one of them. Each one of them, you can look at an element of it and go, but there's an exception to that, or that's not always true. So for example, let's look at feelings of distress. So if we use the standard of subjective feelings of distress, then anyone who thinks they have a problem automatically qualifies. So a person could self-diagnose really at any time as having abnormal behavior or psychological disorder, or consider themselves psychopathological. What about bizarre or weird behaviors where the person's doing quite fine? They have no problems in their life, they're not unhappy at all, just whatever it is that they're doing or however it is that they do it, people just find weird or bizarre. And then we might also think about, what about happy people? So if we're looking at statistical abnormality, most people are not happy all the time. So if we looked at your standard bell curve, those who are definitely more happy than others, most of the time they're in the minority. a very slim, small minority, probably 2% or less. So based on our standard of statistical abnormality, we might have to say that these people are psychopathological simply because they're happier than other people. I don't think that we would want to do that at all. So what's the key principle? So for those 5 keys that we would look at to start with and say, even though they're problematic, what's the key idea or the key thing, the underlying foundational principle that we can look at that helps us determine whether each of these 5 is valid or not? And that key principle is this. It's the key principle of functioning. That is, how do you function in your daily life? How do you function as a father? How do you function as a mother, as a brother, a sister? How do you function as a boss or as a co-worker? Or how are you functioning as a parent? How are you functioning as a church member? How are you functioning in your community? And as we look at each of these keys, we have to determine, most importantly, what is your level of functioning and how is it impacted? And the more that is impacted, the stronger likelihood is that we are dealing with some type of psychopathology or psychological disorder.